Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Timeline in psychiatry. So we are looking at some very important diseases. So we start with the manic episodes. So here in the manic episode, the duration is at least 1 week. So you have at least 1 week is the duration. Then is the hypomania. There is hypomania. So in terms of hypomania, it is at least 4 consecutive days. So 4 successive are the continuous days. Then major depressive disorders. You have major depression disorder. So major depression disorder, it lasts for 6 to 12 months. It lasts for 6 to 12 months. So the 6 to 12 months with episodes for 2 or more weeks. So there is 2 or more weeks. So this will be major depressive disorder. And then cyclothymia. Cyclothymia means at least 2 years. At least 2 years. Then we look at the dysthymia. So dysthymia means at least 2 years. Dysthymia means at least 2 years. Then we look at the maternal blues. So here in maternal blues, it starts 2 to 3 days after the delivery. So it will start 2 to 3 days after delivery. So this is maternal blues, and it will usually resolve within 10 days. So they are telling that it resolves, that is, it gets cured in 10 days time. Then we move on to the postpartum and the disturbances. So postpartum, mood disturbances. The postpartum mood disturbances, the onset is within 4 weeks of delivery. So the onset is within 4 weeks of delivery. Next, let's look at the brief psychotic disorder. So brief psychotic disorder. So here in brief psychotic disorder, it lasts less than 1 month. So it will last less than 1 month, and it usually is stress related. It is stress related. Then we move on to the schizophreniform disorder. So it's the schizophreniform disorder. So here in schizophreniform disorder, it lasts for 1 to 6 months. So it is 1 to 6 months. Then the schizophrenia. Schizophrenia, if you see, it will last for greater than 6 months. So schizophrenia disorder is 1 to 6 months. Schizophrenia is greater than 6 months. Then what about the schizoaffective disorder? So when you look at the schizoaffective disorder, this lasts for greater than 2 weeks. So lasts for greater than 2 weeks. This is the schizoaffective disorder. Then when you look at the delusion disorder, it lasts for greater than 1 month. So it will be greater than 1 month. Then is the panic disorder. There is panic disorder. So in terms of panic disorder, as an episode followed by 1 month of the concern. So there is an episode. So there is an episode which is followed by 1 month of concern. 1 month of concern. So 1 month of concern of additional attacks. Then comes the specific phobia. There is presence of specific phobia. So specific phobia, it lasts greater than 6 months. So it will last greater than 6 months. And generalized anxiety disorder. So generalized anxiety disorder, we are calling it as GAD, and this will last again greater than 6 months. Then the acute stress disorder. So the acute stress disorder, this will last between 3 days to 1 month. So 3 days to 1 month time is the period for this. Then we look at the PTSD. So when you look at PTSD Adjustment disorder is the symptoms it occurs within 3 months of the stressor and lasts less than 6 months. So it occurs within 3 months. It occurs within the 3 months. And till when does it last? It will last less than 6 months. Then we have something known as the mean. Next we have it may last. So this adjustment disorder, it may last. Last is greater than 6 months and in presence of the chronic stressor. So it may last in presence of greater than 6 months and the chronic stressor. Then we move on to the bulimia nervosa. So what is bulimia nervosa? So bulimia nervosa, it means that it is at least 3 months. At least 3 months. And somatic symptom disorder. Somatic symptom disorder. This will last at least greater than 6 months. It will be greater than 6 months. Then the separation anxiety disorder. In terms of the separation anxiety disorder. So separation anxiety disorder is common onset at 7 to 9 years. It is common disorder at 7 to 9 years. Then we move on to the Tourette syndrome. Tourette syndrome. So Tourette syndrome is the onset is less than age of 18 years. So it's less than 18 years of age and the tics that are present is greater than 1 year. So tics are present, it is greater than 1 year. Then we have something known as the ADHD. So in terms of ADHD, the symptoms is for greater than 6 months. So it will be greater than 6 months for the symptoms. To learn and grow daily like this, please do subscribe.